make efforts to ensure that older persons. So I want to welcome all of you this evening and say that we are looking forward to a wonderful evening. The two speakers we have tonight are known professionals in these areas, and I know that every one of us who is here this evening will enjoy it. Thank you for being on board. I wish us happy deliberations. Thank you.
Thank you.
Thank you so much, Senator. We're glad you could make it because I know that you're somewhere very, very important. Thank you so much for making out the time. Today is going to be very, very interesting. It's going to be very, very full of information. I can assure you, because we have in the house to talk about this world-renowned people, specialists in their areas. It's important that we know that WHO says that cervical cancer especially is the fourth most common cancer in women. In 2018, an estimated 570,000 women were diagnosed with cervical cancer worldwide, and about 311,000 women died from the disease. Unfortunately, no one needs to die from it, because when diagnosed, cervical cancer is one of the most successful treatable forms of cancer, as long as it is detected early and managed effectively. And that is the reason why we believe in cross-roping, that information is power. Cancer diagnosed in late so be controlled with appropriate treatment and palliative care. So this evening, we'll be having people who will be telling us much about, Mrs. Young will be telling us much about cervical cancer. Of course, we have also one of the world-renowned people on cancer who will take us through prostate cancer, which is also a common type of cancer for the male folks. But it is highly treated it is better and when treated early in their early stages. It begins in the prostate gland, which sits between the penis and the bladder. Well, it's not for me to tell you all about that. We have, of course, like I said, world-renowned person in the house who will be taking that topic. I would like to call quickly, because we do not have much time and there's so much information and I'm sure so much questions to be asked. I would like to tell us a little bit about Professor Ifeoma Okoye. She is a change maker, contributing significantly to improve quality of healthcare in Africa through policy changes, capacity building, workshops, and strategic roundtables. She has mentored several clinicians in the area of radiology, driven a cancer organization to raise over 8,000 cancer preventive activists who intervene in communities, impacted over 60,000 lives in 15 years in 27 states. Through education, screening, vaccination, financial cancer treatment of indigent patients, and sustained advocacy to improve Africa's healthcare indices, economic growth, through scaling up capacity for clinical trials. Apart from screening over 2,000 men for prostate cancer through the ages of her NGO, BWS, and in collaboration with two other NGOs, Marjorie Bash Cancer Foundation and Project Pink Blue, she has a section in her public education cancer booklet dedicated to prostate cancer, and also is the principal investigator of CAP PTC UNN site. That is Prostate Cancer Transatlantic Consortium. She also is into the clinical trials on prostate cancer, implementation science studies on prostate cancer, and National Cancer Institute Clinical Proteomic Tumor Analysis Consortium, CPTAC, a comprehensive coordinated effort to accelerate the understanding of the molecular basis of prostate cancer. You can see that we do actually have the best in the house to discuss this topic. And I pray that many more people would avail themselves of this wonderful opportunity. I want to call on our very own beautiful Professor Ifeoma Okoye to unmute her mic and take the stage. Hello. Hello.
Hello.
Okay. You're on.
Okay. Just 1 second.
Okay.
I've been battling with my to make sure my presentation will show. Just 1 second.
While we wait for her,
Okay, I'm set.
okay, you have the floor already.
Okay.
Yes, Prof.
Good afternoon, good evening, good morning, depending on where you are hooked up from. Can you hear me? Can you confirm that you're hearing me?
Yes, we can hear you.
Okay. So today we are going to talk about prostate cancer, what every man should know, what every man should know. It's a public health perspective to prostate cancer. So welcome to this session of this event. Our goal is to help you learn more about prostate cancer, encourage you to take action for your health, and make you an ambassador for Oga Blue. A number of NGOs came together a couple of years ago and put together a project called Oga Blue for Prostate, Oga Blue for Prostate, something catchy just to catch their attention, because over 70% of prostate cancer patients come late when the disease has extended beyond the organ of origin. And once that happens, you can have the cancer going to your bones, to your bloodstream, metastasizing even to your brain. So it's not a very good situation. And the best thing for cancer is early detection. Now, this presentation is proudly brought to you by all these different organizations that you can see on this slide. And what we'll be talking about today is trying to get us to understand what the prostate is, where it is located, what is prostate cancer itself, how common is it, what causes it, how does prostate cancer manifest, how does it manifest, who can get prostate cancer, and can prostate cancer be prevented? The test that we need to do to find prostate cancer early, and what you as an individual can do to check yourself, and where and how to get more information. So let's look at what prostate cancer is, or what prostate, just the organ prostate. It's an organ that only men have. It's only found in men, just like the uterus and the cervix and the ovaries are all found in females and not in men. So it is a gland. If you look at the picture beside you, you can see where the prostate gland is being shown and indicated in that film. We're going to see more of it, more pictures that will help us to understand exactly its location. It is in front of the rectum and it is behind the bladder. So when you want to access it, you can use filling the bladder and using ultrasound to look at it, or you can put your finger in the rectum and you can feel the prostate. And you can equally put an ultrasound probe through the rectum and you'll be able to do a detailed study of this little organ. The size of it is that of a kola nut. And in English, beyond these circles, some people will say a walnut-sized gland. When it is healthy, when it is not healthy, it grows and gets enlarged. We'll talk more about this enlargement because it differs depending on what is enlarging it. So the gland, as I said, is located underneath the bladder in men. It is shaped like a donut and fits around the tube called the urethra. The urethra is the tubular passage from where the urinary bladder empties the urine from the phallus of the male. And it's called the urethra. It carries urine out of the bladder. Now, because of this very synergistic relationship, it tends to, when it enlarges, cause problems with the urinary passage. And what some people just in medical circles, we usually refer to men and tell them your waterworks is having some problems. So as I said, it's only found in men and it helps in producing sperm. It's useful in making men fertile, and it enlarges as men grow older. Now, looking at what prostate cancer is a leading cause of death and disability and suffering to increasing numbers of Nigerian men, and its annual incidence in Nigeria is quoted to be 127 out of 100,000 men, and it's one of the highest in the world. This incidence is one of the highest in the world. Increasingly, many Nigerian men are being diagnosed with prostate cancer, and often at very advanced late stages, which I mentioned earlier, when unfortunately little can be done except to palliate and keep the patient as comfortable as possible whilst waiting for the inevitable death. This is the stage where we don't want anybody to get to. And that's why when people are asking us what are the symptoms and signs, we don't want you to wait for symptoms and signs. We want you to come out and offer yourself at the right age, from the age of 40, for you to be screened. Now, one of the things that truly that you will see as we go on is that prostate cancer is actually the third most common cancer when you put both men and women together. Cancers in men and women is the third most common. The first is breast cancer. I'm talking about statistics in Nigeria. The second is cervical cancer, followed by prostate cancer. Now, when you talk about cancers in males, it appears to be to top the list, followed closely by colorectal cancer. So prostate cancer is a very variable disease. In the Federal Ministry of Health, the cancer desk, the prioritized cancers in Nigeria are breast cancer, cervical cancer, and prostate cancer. The others are also looked into, but not as stringently and more vigilantly than as they do for these three. They call it the three topmost cancers in terms of incidence in Nigeria. Now, prostate cancer is very variable. It's a very variable disease. Some tumors remain small and grow so slowly that they cause no problems and often remain undetected for decades, which is why, masterly inactivity is one of the methods of, treating it, or medical management, seeing what kind of, type of prostate cancer it is, how aggressive it is, and then, how you're going to attack it in terms of management. Now, some others are aggressive, meaning that they quickly spread and, devastate the patient and grow quickly and become life-threatening to that patient because it disseminates, as I said, into the bloodstream, into the bones. You can have, bone fractures because it tends, since it's a paired organ, it tends to, cause lytic, what we call reduced density metastasis, lytic metastasis. So many of these ones, where they cause severe and aggressive disturbances, they spread to and cause a lot of pain for these patients. We'll talk more about this as we go on. Unfortunately, I'm presenting from my phone, and this slide is actually a video that would have shown us quite a bit of this relationship I was talking about. So unfortunately, I'm presenting from my phone, so it's not activated. So if we look at this, it's like we picked that the prostate gland, and we've sliced it across longitudinally. Vertically. Okay. So if we do that as a vertical cut, you can see that starting from my left side, you see something that looks different from the rest of the tissue. That is the beginning lesion, the beginning growth of the cancer. So at that stage, it is at stage 2, and then it progresses to stage 3, where it's still within the prostate, but it has extended into the capsule. You don't want that. And then you can see that it has externalized beyond even the capsule. Then, so many disorders can cause the prostate to enlarge. I alluded to this and I said we'll talk about it soon, which may block the urethra. So like I said, because of the contiguous relationship of the of that prostate gland. It more or less encases and surrounds the urethra. So when it begins to enlarge, you can see in the middle portion of this lobular thing we are seeing, as it is enlarging, you can see that the urethra in the center portion, the tubular structure there is beginning to narrow. And the more it grows, the more it narrows. So it leads to certain symptoms that the patient will come with, and you begin to know that the patient has an issue with his waterworks. Now, it isn't only prostate cancer that can enlarge the prostate. In fact, prostate cancer does not really enlarge it significantly as much as what we call benign prostatic hypertrophy does. So any man can be affected by age 50, but a lot of people drop that age to 40 because we are beginning to see it happening a lot, in younger men. Most men have some prostate enlargement, but problems can occur in younger men too. So regular checkups can detect problems. Examinations may detect problems before symptoms develop. And that's when you want to detect the problems. When detected early, so prompt medical attention is sometimes necessary. Benign prostatic hypertrophy happens virtually in every man. And so you find that what you need to happen is that you make every man aware of their prostate, what we call prostate aware, just like we said, be breast aware. For men, we are saying be prostate aware. Even for their women, you'll find out why I said even for their women, because sometimes it's even the woman that now tells her husband that, darling, something is going on. You are not quite being able to see the bowl of the toilet. Okay? So prostate cancer, how common is it? Most common cancer among men in Nigeria starts around 50 years. Black men have more severe prostate cancer. Indeed, what really happens, the statistics shows that Black men in general are 60% more likely to have prostate cancer than their Caucasian counterparts. And if you look at this, this graph, you can see that amongst the cancers that express themselves in males more commonly, you see that prostate cancer has the highest, significantly highest incidence, followed by colorectal cancer, liver cancer, skin cancer, and lymphomas. So what are the symptoms and signs? Everybody wants to know this. How would I know? How would I suspect that I have prostate cancer? Now, one of the things that can happen to a man is that his sleeps begin to be interrupted by a constant need to urinate. So as a woman, you find that you are always looking for your husband because he has to escape to the bathroom to empty his bladder. Another thing that the man feels, which a lot of them ignore, is a hot burning feeling in their pelvis being between their thighs, the groin area, feeling like a hot burning feeling there. And then, right inside, not just between, but right inside. So another thing that people feel is like as if he's carrying a golf ball, in his rectum, that is in his, where the feces passes out in the aspect. I told you that the prostate lies directly anterior to the rectum. That's why you can feel it by putting your hands inside, your finger into the rectum. Of course, from what I had already described, it causes difficulty in passing urine. So not only does it cause them to have interrupted sleep, and and they need to get up, and they go to empty their bladder, and they find that they don't really have that much urine, but still they have that urgency to go and urinate. So when they get there, they find they have difficulty in passing urine, and then they have inability to urinate. Okay, it can progress from difficulty in passing urine to inability to urinate. And then passing urine often, particularly at night, as I mentioned, is urgency. Weak or interrupted urine flow, which I'll try and demonstrate by some schematic diagrams that you see in the next slide. Pain when urinating and blood in the urine. So when you look at this, you can see that the man has blood in the urine, is having to force out urine, and he targets the bowl of the toilet, but he hasn't quite hit it because his stream is no longer able to shoot out as it usually does. So instead of shooting out, it's dripping. So it drips with before the toilet bowl. So it's actually on the floor, he's weeing. And at times he finds that it's not really something he's aware of. And it's his wife that will come and say, darling, why do you urinate, on the floor rather than inside the toilet bowl? And then it comes to a situation where it's increasing, and then of course it's invading the tissues, and he's now unable to urinate, and he may need to have a catheter passed in. It is at that time that most men will now start looking for a doctor to see, which is very unfortunate. You find biting pain, you can see the man really, but then the man becomes very wearied, lower back pain ensues, by which time maybe it has even spread to the bones, and frequent urination, then erectile dysfunction also happens. Unfortunately, also a lot of complication of erectile dysfunction, even with the medical and surgical management that then happens later on. Then burning sensation that he has. So these are all, trying to show graphic descriptions and feeling that the bladder is still full when he has actually he doesn't have a full bladder. Okay. An urgent need to urinate. So you find a man struggling, and before he even gets to the toilet, he's already dribbling. And then he has terminal dribbling. After he's already passed urine, he finds that there is still urine that he can, more or less push out from his penis. So these are some of the things that a man may experience. The warning signs, early signs, poor urine flow frequency, once you start having this. But the important thing is, please, 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 don't wait for any signs at all. Once you hit 40, go and see your doctor. We'll show you the recommendations as they are aligned. But I like to err on the side of caution, rather that the doctor will tell me it's too early to come now, or than my not going to make sure that I get screened early enough. So late pains, painful urination, back and pelvic and waist pain. As I've described, I don't think any of us will forget these signs and symptoms. So this is a kind of, which I have incorporated in a booklet, that a public health booklet we have, which we wrote on breast cancer, cervical cancer, and all that. And what we try to do is to have males fill this questionnaire and give us some information, like when you want to pass water, which is urine, is there delay before you start? The question is no, sometimes, usually. I'm not going to go through it because of time. But basically, what we are trying to obtain is information. So by the time you go through this questionnaire, you yourself will know, I need to hit the doctor's clinic as soon as possible. So what causes prostate cancer? At this time, nobody knows the exact cause of prostate cancer, but we know things that make people more likely to have the disease. And these things are called risk factors. Risk factors are not causes, but they are the ones that increase your susceptibility and ability to come down with some of these issues. Now, remember that cancer in general belongs to the non-communicable diseases. And cancer is a group of diseases, over 200 diseases that are, result from the abnormality of cells that become anarchist and just behave and refuse to die unless you target them and deliberately kill them. The usual thing with human cells is that when they finish their duties, they die and they are passed out of the system. But these ones, they don't die. They just continue to proliferate, take blood vessels from wherever they can find it. And the blood vessels, because they're taking them from wherever they can find it, and they are more than they ought to be, what we call neovascularization. They are not good quality blood vessels, and they tend to be fragile and they bleed. So you find that, bleeding is one of those late symptoms that somebody would have. So prostate cancer risk factors include the following: age, which you can't do anything about. So every time you're talking about risk factors, talk about risk factors that you can't do anything about and risk factors that you can do something about. If we're not talking, please, can we mute so that I will have a quiet environment? Thank you very much. So age, as I said, older men get prostate cancer.
Somebody, Vincent, is driving. Vincent, can you be on mute, please? Vincent.
Is somebody saying something to me?
No.
Somebody's driving. Let the person be on mute.
Okay, yeah, they can. Everybody should mute. All right, thank you very much. So the age, as I said, older men get prostate cancer. I remember that we said start checking from 40. Science likes to err on the side of caution. But I like to be a bit dogmatic about these cancer issues, Rather let me be told that I'm panicking than that I didn't come early enough. So it starts sooner among Black people around 50 years. But some literature tell you 40. Prostate cancer risk factors, continuing on it, there is the one that has to do with your race and your ethnicity. I've already said that Black men, like Nigerians, are at a very high risk. In fact, they tend to have more of the aggressive forms. And Black men are 60% more likely to have prostate cancer than their Caucasian counterpart. One of the things we are doing recently, studies that being done across board from African Americans through to their African counterparts, and even trying to match and see if we can trace relationships, is to see if there is something that we are eating that is the culprit that is actually underscoring the reason that is actually underscoring. Somebody is saying that my volume is low. Oh, sorry. Is it better now?
Yes, we can hear you.
Oh, okay. Okay, great. So, one of the scientific researches where it's a multi-center thing that we are doing with some diaspora members that are working in America, and those of us who are here on this side of the divide. We have Cameroon, we have Ghana, we have Nigeria, and I happen to be the PI for UNTH, principal investigator. And we have huge data sets that have looked into studies that have to do with our diet. Okay, so I actually, push all that information out, especially its relationship with vitamin D is the most, father or brother, your prostate cancer risk would increase. Now, the risk is also much higher for men with several affected relatives. For instance, you have an uncle that had a grandfather that you had a father, you had a brother, So the more the relatives that have had prostate cancer, the more, the higher the probability that you're going to have it. So the risk can be higher if your mother or sister had breast cancer. Very, very important to note that. So these high-risk groups, if you know that you're falling within this high risk, you should be more vigilant with how you go chasing after having yourself checked. So at this time, scientists are not completely sure about how to prevent this disease. And some diet supplements and vitamins are said to help, but this is not clear. However, we are still groping and extrapolating and giving recommendations. Now, if you look at this particular slide here, it talks about the life course prevention of cancer, illustrating how nutritional factors at various stages of the life course, starting right from the fetal life. Okay, what is the mother's nutrition like? What are the carcinogenic exposures that she's exposed to? Fetal growth and birth weight. And you can see that already there is a trigger. And it continues in infancy and childhood, breastfeeding, infection, and malnutrition, contaminants, air, food, growth, environmental pollution and all that, and inactivity, the food choices, obesity begin to even play a role in infancy and childhood, into adolescence. Smoking, contaminants, drinking, alcohol, inactive, sedentary lifestyle, and all that. And then pregnancy and lactation established. So all these risk factors adding up, and you see accumulated as you get older, which is why age plays a role. So one of the things that have been noted that seem to make a significant difference in prevention is tomato. It contains what we call lycopene. Now, lycopene is the major content of tomato that has an effect both in reducing, the risk to prostate cancer, and even whilst you are treating and the person is taking it, it seems to also complement your treatment and help to improve, progress. So men who ate more than 10 servings of tomato-based foods daily, like cooked tomatoes and tomato sauce like stew, had a 35% lower risk of developing prostate cancer, especially the aggressive type of prostate cancer, than those who ate the least amount of this food. The unique thing about tomato is that unlike other vegetables, the lycopene content seems to improve with cooking. You have less of the lycopene content, in the uncooked tomato than in the cooked one. So the benefits of lycopene was more pronounced with advanced stages of prostate cancer. So high level of lycopene in the blood was associated with low prostate-specific antigen, which is the marker that we usually use, even though it's not very, very specific, but it is still what we are still left with to use as a marker to know, what is your risk factor, more or less, and how much you are responding to treatment. So lycopene in tomatoes are better absorbed when tomatoes are processed. Now, lycopene does not only exist in tomatoes, but it's where you find the highest quantity. You can find it also in watermelon and some other red vegetables. So generally, watermelon too. Yes, I said watermelon. So you choose foods and beverages in amounts that help achieve and maintain a healthy weight. Eat lots of vegetables and fruits each day. The reason for this is that your normal body metabolic processes produce what we call free radicals. Free radicals stimulate inflammation in your system. Now, those free radicals that are produced by your normal, body metabolic processes are inundated and made worse when you are not obeying best practices. You don't exercise, you're sedentary, you smoke, you drink alcohol, you eat processed foods, you eat unhealthily, you are obese and all that. Non-communicable diseases in general, cancer is one of the non-communicable diseases, and all of them share the same risk factors, and they are lifestyle modulated diseases. Oh my God. I thought I put do not disturb. Sorry, please. I'm using my phone to to present, and I put it in do not disturb. I don't know how come somebody was able to come through. So as I was saying, generally, I just want us to know that for everybody seated here, you can reduce your risk to cancer and to all the non-communicable diseases like cardiac diseases, hypertension, chronic kidney diseases, stroke incidents, premature aging diseases like arthritis and all that, and diabetes, and of course, obesity. They are all due to inflammation. Inflammation is what powers them. And when you eat enough fruits and vegetables, they produce what we call antioxidants and are able to supply it to your body and use it to nullify and clear out these free radicals that are the ones that cause those inflammations across your body, that put them in a process where they are able to, cause all these chronic diseases in your body. So to help you fight non-communicable diseases in general, including cancer, which is a non-communicable, you eat a balanced diet, do not leave everything in moderation, eat a healthy diet with a variety of 10 to 12 servings of fruits and vegetables daily. Eat more of vegetables, especially leafy green vegetables, in as raw a form as possible, not overcooked. Eat your fruits before or in between meals and not immediately after meals. Eat more vegetables, lentils, beans types. We have very lovely lentils, in Nigeria. Forgive me if I use Igbo words, akidi, opa, fiofio, and all that. And our natural complex carbohydrates, sweet potato, cocoyam, yam, cassava. But what do people do? They go and eat, Indomie and the rest of them, and imported basmati rice and all that. These are processed things. Yet we have all these lovely carbohydrates. So we should eat in moderation. 2/3 of a plate you're going to of your plate, 2/3 of it should be made up of vegetables, and the balance 1/3 of it should be made up of your carbohydrates and protein. Okay, your meat. So get regular physical exercise, at least 3 to 4 times a week, sustaining your body in motion for at least 30 minutes each time. Ensure you sweat and your heart beats fast. Please, let me just advise us. These are the most important things that you need to do to modulate the the lifestyle-related diseases that I just talked about. And they are the big diseases that we all fear. They are the ones that are causing all the deaths, So they sound mundane, but they are just what you need to do to cut your risk. So drink plenty of water, replace all your sugary drinks with water. You are 80% water. So best to drink water like an hour before or an hour after food, not with food, and just before you go to bed and immediately after you get off from bed, and you drink it in a bolus. Don't sip. Drink water in a bolus, and try not to drink cold water. Drink either room temperature water, but the best is warmed up, water. Water that is warmed up is the best water that you can use and for your water therapy, and make sure that all your skin is getting as much hydration as possible and is able to help you flush and detoxify. You get 10 to 15 minutes of sunshine a day in order to get that vitamin D that I told you that from the studies that are coming out now. Vitamin D is going to play a huge role in reducing your risk to prostate cancer. You take in plenty of fresh air, get help to stop smoking if you're a smoker, allow yourself 8 hours of sleep at night for optimal rest, reduce stress. Trusting in a higher power helps reduce stress. Limit or eliminate your intake of alcohol. And also, these are all the other things, that would help you. But because of time, let me just rush on. So basically now I've said stop smoking, reduce alcohol, maintain a healthy weight, because obesity definitely creates an ability for you to move in with these non-communicable diseases. So physical activity in any form, you can see that physical activity, how can you take some nutritional supplements. Why? Because taking 9 to 10 to 12 servings of vegetables and fruits, not easy with a busy schedule. So you can supplement and make sure there are natural supplements that you're using, but don't use them to replace. All I'm saying is use them to complement. Then talk with your doctor before starting any vitamins and supplement, just to make sure that there are no risks to, some kind of reactions with whatever drugs that you are on. So make the right lifestyle choices today instead of "it's not my portion," because a lot of people are in denial, procrastination. Now, if you look at these sugary drinks, sugar fuels cancer, feeds them, and fuels inflammation. So you can imagine the amount of, sugar you're taking in. Another thing is all these enhancers, food enhancers, the ones that are cubed and the ones that are powder, they contain monosodium glutamate. They've been found to be carcinogenic. Processed meats too, sausages, all these things we think are fancy, westernized diets. We leave it and go to wholesome food that God has kept in abundance for us. You can now see that you look at all our local foods that have been proved scientifically to contain cancer chemopreventive. Our peppers, the ginger, the garlic, the soursop, they are all there. So you can see all that, the vegetables and all that. So what can I do, to know my situation? There is screening. It's a test that can be done for early detection. And the goals for screening are to find the disease early when the lesion is treatable, early when the lesion can be cured, early lesion when minimal side effects will result from treatment procedures, and early lesion when less morbidity and mortality is likely, early lesion when the cost of cancer treatment will be cheaper. I tell you that it is a win-win situation for you to voluntarily go at the right age and present yourself. Okay, so what screening for prostate cancer can be done by digital rectal examination, putting your finger in by a professional, usually a urologist who do that, put their finger in and feel. There are certain things that you look for, the capsule, the flexibility, the texture and all that. Use it. You can also put a probe, what we call a transrectal ultrasound. I'm rounding up. but if you want me to just stop abruptly, I can do that. But let me finish with the screening. I promise you in the next 2-3 minutes, I'm done. So what screening for prostate cancer can be done with prostate-specific antigen. It's a blood test. I'm sure it's the one that most of us know. Is how that, indicates that you are at high risk for it to be truly that. Of course, the definitive test is to do, to do a tissue biopsy and look under the microscope and all that and verify histopathological diagnosis. So neither the PSA test nor the digital rectal examination is 100% accurate. Abnormal results don't always mean that cancer is present. Normal results always don't mean absence of cancer. Of course, when you come in late, we do other things like we do CT scan, we do MRI just to see where and where these have disseminated. If cancer is found, neither test can tell how likely the cancer is to grow and spread. And this all defines management, whatever you find. So here you see the recommendations. At age 40, talk with your doctor about testing and your personal risk. At age 45 to 50, obtain baseline PSA, PSA, and then do the digital rectal examination. If the PSA is above 1 nanogram, repeat, okay? Repeat the test every 1 to 2 years until 50 years. And if the PSA is below 1 nanogram, repeat test every 2 to 4 years. For this recommendation slide so that you know exactly what you when and when you need to. But after the age of 70 and over, you talk to your doctor and decide whether together if routine prostate-specific antigen testing should continue. So from 40, you begin to be very, very vigilant. Okay, if your family history of prostate cancer, start testing earlier and do annual. So see your doctor to get your prostate screen and receive advice to tell other men about the importance of seeing a doctor regarding prostate cancer. For more information, you can reach any of these NGOs that put together this Oga Blue outreach. We reach out, we go to the different communities, faith-based organizations, and virtually all sorts of communities to give this information. And this doctor is a survivor and he's right at the forefront of it. So thank you very much. Nagode, Dalo.
Thank you. I wish it's so interesting, Prof. So interesting. I didn't know it would be this way. And you could just go on and on and on and on and on. Awesome. Thank you so much for this sacrifice. Thank you so much for this time. We're so grateful. I'll quickly just run through some of the things that I think will stay on with me, and I hope it would with other people. And that is, it's told us that the best thing we can do for ourselves is to do checkups, because early detection is very important for cancer, especially breast cancer, cervical cancer, and prostate cancer. And then you told us also that Black men are more likely to have prostate cancer and could start around the age of 50, but we should do tests, start doing checkups from the age of 40 years, if not earlier. I also learned from this that constant urination, that is things to watch out for as early symptoms, is constant urination, urinating, difficulty in passing urine, hot feelings in the pelvic area, and if you are, then you have this weight, you feel this weight that is like you're carrying a golf ball in the rectum, and then inability to urinate, dripping, wee, terminal. Then, of course, the late Okay. I don't know about you. I've learned much. The risk factors here, age and race, ethnicity, of course, the one that concerns us, more Black men are affected. Having a relative that must have had prostate before tends to be, increase the risk. And also having a mother who had breast cancer could also increase risk. 1 out of every Black man is likely to have prostate. That is very serious. Inactivity, obesity could also cause a lot of problems. Then I also saw that tomatoes, watermelon, could reduce our risk. And then eating more vegetable. You said we should eat at least 2/3 of our meal should be vegetables. Avoid drinking cold water, and we should also drink a lot of water, and also includes before going to bed. It's interesting to know that we have a lot of vitamin D, which would reduce the risk, and yet we see a lot of problems here in Africa. So you're saying that if we can get 10 to 15 minutes sunshine daily, it would help. Those that like to stay in the AC, a lot of air-conditioned room, from car to air-conditioned room to everywhere without having sun, you should take note of this. And lots more was said. Very interesting. I want to say here a very big thank you to Professor Ifomokoye. She's been awesome. If you have, please drop it in the chat room. We'll be taking it immediately. At this point, okay, I think the questions are coming. We have comments like, thank you, Prof. Wonderful presentation. There's room for questions, but you need to write it. We've entered the time for the next speaker. I guess all the questions will be taken at the end of the program. And then that will make it easier for us. I want to, at this point, quickly introduce to you Stephanie Young. She is a seasoned woman as we enter into the topic for cervical cancer. She is a seasoned women's health educator and chief education officer at Health Platforms International, where she empowers individuals, especially women and girls, with knowledge and skills to prevent and manage a number of health conditions. Stephanie's organization pop-up clinics across major cities in Nigeria to provide affordable, quality, preventive healthcare services to a target population. She is also the programs director at Women's Health Platforms Foundation, an NGO providing free screening and early treatment for the prevention of breast and cervical cancer. She is admired in the industry and has the capacity to deliver on the current demand for health literacy for improved health outcome in Nigeria. There she is. I know she came in early in this program. You may unmute, madam. You have the floor. Take the floor now. Thank you so much for being here. We're grateful.
Thank you. Thank you so much for inviting me. I'm happy to be here. I've learned a lot as well. I'll just want to confirm if everyone can hear me.
Yes, we can. We can hear you.
Okay. All right. Okay. Thank you very much. So we just go straight into it since you've introduced me already, right? So I'm Stephanie Young, and the program director at the Women's Health Platforms Foundation. So cervical cancer is the second most common cancer affecting Nigerian women, So you have breast cancer at the top of the list. So in the year 2020, there was about 604,000, above 604,000 cases. And sadly, we lost about 341,000 women to this disease. Now, when we hear these things, many times people are confused because we know that these diseases are preventable. So cervical cancer, breast cancers, and prostate cancers are 100% preventable with early detection through regular screenings. So what causes cervical cancer, right? So cervical cancer is caused by, simply put, an untreated HPV infection. So HPV is short for human papilloma virus, and this virus is sexually transmitted, right? So most times you have men as the carriers of this virus, and through sexual intercourse, it is introduced into a woman's cervix. Now, a woman doesn't know about it. She doesn't go for screenings. And these diseases also do not have signs in that sense, but there are some signs that some women have reported, right? So there are signs like signs to look out for, early warning signs. You have pain during sex, bleeding during sex, excessive vaginal discharge, low back pain, lower abdominal pain, and things like that. But you'd agree with me that these signs are also common to other diseases as well, which is why they say go and screen early. So if there's anything there, if an infection is found, it can be treated. So someone will say, what if I go, and screen and get a positive result? What then happens? So the reason why they say screen regularly is so if anything is found, it can be treated on time. So I always like to correct this myth that a lot of women have when they say you tell them to go for screening. In our experience, even when you offer free screenings, you still see people say, no, I don't want to. And they say things like, what I don't know won't kill me. I know a lot of us are really familiar with these terms. What I don't know won't kill me. It's better not to go and check. What are you going to check? When you even see some women coming to the clinic, you hear their friends telling them, what are you going to check for? But these screenings are for prevention. So if you screen on time and a HPV infection is found, it can be treated early enough, which is the whole idea behind regular screening. So I'm just going to share my screen really quickly so we can see what this picture looks like. So I'm going to be showing us the cervix in the female reproductive system. Can we all see my screen, please? I'm sharing now. I believe we can see my screen.
Yes, we can.
Okay.
We can see your screen.
Okay, thank you. Thank you very much. So this image, I call it the cervical cancer staging, right? Because we like to tell women that cervical cancer doesn't just happen, because many times when we hear these stories, oh, this woman had breast cancer, or that woman had cervical cancer, or died of cervical cancer, you hear, hey, yeah, what happened? Now, the truth is that this infection has been there for a long time, but the woman did not screen. She had no idea she had this infection. And then you just see that the infection keeps progressing until it gets to the stage where it turns into cervical cancer. Now, this is the female reproductive system. So right here is the vaginal canal. The period comes out from here. This is also the site for sexual intercourse. Now you have the cervix around here. So the cervix is like the neck of the womb, right? And then you have the uterus somewhere around here. The uterus is the womb, where you have the baby. Now, a closer look at the cervix, this is what it looks like. That's when the cervix is facing you. So when a woman goes for screening, this is what they see, at the cervix. So there are different kinds of screenings available. But before then, I'll just explain the different stages. So you can see this is what a normal cervix looks like. When you go to this stage, you can see that cancer is beginning to develop here. Here, you have the tissues already being affected. And at this stage, the woman is already bleeding, right? So there's a healthy cervix going on through different stages before turning into cervical cancer, right? So this is why they say early detection is key, and regular screenings is important, because when a woman goes to screen early, you find a HPV infection, you can always treat at this point. And many times you see that the woman's cervix goes back, to being normal, right? But if that doesn't happen and a woman doesn't screen, you now see that it continues to progress through different stages. Now, many times we say sexually active, when a woman becomes sexually active, she should begin to screen. But what we've understood is that some people do not even understand what being sexually active means, right? So when we ask women, they come into the clinic and you're filling their forms for them, and you're asking some women, how long have you been sexually active? You hear people say things like, I was sexually active before, but I'm not sexually active now. Or I used to be sexually active, but for the past 6 months, I haven't been sexually active. Now, the question they are asking you is, have you ever had sex? Simple. Now, even if it was once or twice, you are at risk and you should get screened. So nearly all sexually active people have this virus, right? But even if a woman is infected, depending on a woman's immunity, it can progress through these stages. But some women have a high level of immunity. You find that it doesn't progress, it even clears off on its own. Now, depending on the stage where a woman gets to the hospital, if she has a screening and tests positive to the HPV infection, there are different treatments available depending on the stage where the woman visits the clinic, right? So there's a treatment called cryotherapy, where these cells that are infected are freezed. They use liquid frozen gas, so it's either CO2 or nitrogen oxide, and then it freezes these cells, it destroys them, and they come out as discharge, right? So they will tell you for 2 weeks, no sexual intercourse, no inserting of tampons, you just leave the place to heal, and they check you again in 6 months' time. So it is that easy, which is why when we go for screenings, many times people come for these programs, they screen in 10 minutes, they are done, and they're like, is that everything? And we say, yes, that is everything. So cervical screening happens really quickly. So if you are listening to this lecture today and you haven't had a cervical screening done, I think it is something you should consider. Now, another issue we have with these cancer-related diseases is that many people have the notion, that these things happen to old people. But trust me, times are changing. We're beginning to see younger people come down with these diseases, and you're asking yourself, okay, what's the problem? What's happening? Now, another question you get asked when you come into a program to get screened is that when they're taking your history, they will ask you when was your first sexual intercourse. They want to know when you may have been exposed to the virus. Now, take for example, for some people, they had early onset of sexual intercourse. Some people had sexual intercourse at age 15 for the first time. Some people were abused, it wasn't their intention to. Now, from when a woman becomes infected with this virus, it can take anywhere from 5 to 15 years, depending on the woman's immunity. So if you have someone who is starting sexual intercourse very early, add 10 years to that, add 5 years, add 15 years, that's why it's really common now, and you see a lot of people coming down with these diseases. Something else that's important to know is that condoms do not prevent the spread of HPV, right? Because some people will say, oh, it happens to promiscuous people, people who have more than one sexual partner. Yes, that can increase your risk, but it is not the cause, right? So I just want us to understand this. So even if a woman has one sexual partner, you should still go and get screened, for have a cervical screening to check for HPV. So when I was talking about signs, I talked about early signs that some women have complained about. I talked about bleeding during sex or after sex. Now, I also talked about irregular menstrual bleeding, right? Bleeding when it's not your period. So as women, we have this biological clock, our body works like a rhythm, right? If you have a 28-day cycle, and you know that after every 28 days, my period comes, and then you have your periods, say 28 days, and then all of a sudden you've bled for 4 days. Somewhere in between your cycle, you are beginning to bleed again, and you're saying, oh, some women will say maybe the period didn't come completely the first time, right? It doesn't work like that. You shouldn't bleed in between, your menstrual periods. When women begin to experience all these signs, it's a sign that you should go early and see the doctor and get screened. So I'm just going to take us to the second image somewhere here. Permit me. Okay. Can we see this now? Okay, I want to be sure we
Yes.
can see this, please. Okay. Okay, sorry, it's a bit graphic for some people, but this is the reality of what is happening. So when I show people this image, some people say, oh, I don't want to see, they cringe. Now you see this very tiny hole here. That is where your period comes out from. If you want to have a baby, it's the same place that expands, for your baby to come out. So when you go to get screened, it's not this thing. It's a very simple procedure. If you've ever gone to the clinic to have a high vaginal swab, it's the same way. A speculum is passed through your vagina to enable the doctor or trained health professional, it could be a nurse or a trained health professional, who looks at your cervix like this. You see your cervix like this in a screen if you are doing the visual inspection. So there are different kinds of there's the visual inspection with acetic acid called VIA, which is done in low resource settings. So the WHO recommends it because what we found is many people do not go to have screenings because of financial constraints. Now, sometimes you see that now most of these tests are based on cytology, right? So tests like the pap smears and the lipid-based cytology, not everyone can afford that. So, WHO said in settings where this cannot be achieved, you can now go and have a visual inspection, with acetic acid, which is very easy. So once your cervix is viewed like this, the acetic acid is sprayed on your cervix, and if there's a change, just like you see here, if there's a HPV infection, it turns into a white patch. Now you can see this bleeding somewhere around here. That's because the cells on that part of the cervix are already very weak. So any little touch would cause it to bleed, which is why some women will bleed during or after sex. Some women will also experience pain during sex because this part of the cervix is the HPV infection. So during sexual intercourse, this is the point where the penis gets to that some women may feel pain or be very uncomfortable. So when a result is like this, it can still be treated. Now, this is not just an image we got off the internet. This is the cervix of one of the nurses who used to work with us. By the time she came and we screened her, this was what her cervix looks like. And she gave us the permission to teach people using these images because she said, what if she didn't come or because she has always heard about cervical screenings, but she just didn't see it as important. Right, so this is why some women may bleed, and even at this stage it can still be treated because she was treated and her cervix went back to being normal. So if you do not go to screen, you will not know, which is why regular screening is important for early detection. Once you detect it on time, it is easier to take care of it. So when you are going to screen, you are not going to check for cancer like what many people think. You are going to check for the presence of a HPV infection. Now, if this infection is not treated over the years, that is what turns into cervical cancer. I hope we are following. So if you haven't been screened, you should book a screening, right? The earlier, the better. So talking about age, I like to, talk about ages, like real life cases, because many times we feel that, oh, this thing, it happens to old people, so it is not my portion. Just like Professor Ifoma said, it is not my portion. We hear that a lot. You should go and get screened. Nobody is saying it's your portion. No, this is just a preventive screening. The earlier you screen and know what's going on and get it treated, the better. So sorry, are you speaking to me, ma? Okay, I'll just continue then. Now, this lady on the left, like we can see, she used to be a celebrity, in the US, and she was age 27, and she lost her life to cervical cancer. Now, someone will say, oh, that's very young, right? So when she was 21, she went to the screening center, she went to the hospitals, because outside Nigeria, what happens is that once a lady clocks 25, your GP sends you a letter and asks you to come in, to the clinic to have these screenings done. They send you informational leaflets as well for you to read about it, familiarize yourself with these things before you come into the hospital, right? But of course, we know here in Nigeria, where does that happen? It doesn't happen. So at the end of the day, the responsibility is on you to actually go for these screenings and do what you have to do to prevent these diseases. These things do not even take time. 10, 15 minutes, you are done. So what happened in her case is that she went when she was 21 and they said she was too young. By the time she was going back, for the screening, she already had cervical cancer, which was the reason why they brought down the age at which they began to screen women in that particular country. So early screening is very important. Once a lady becomes sexually active, you should get screened from that time. Now, the picture on the right is a lady called Tamika Felder. Now, she was 25. She didn't lose her life to cervical cancer, but she had a complete hysterectomy because the infection had spread, to other organs. She had to take out the most part of our female reproductive system just to stay alive. Now, it doesn't have to get to that stage, right? A regular screening would prevent all of this. So I'm saying this so we can begin to see the reality of these things. A lot of women have lost their lives to diseases that are preventable. And then you keep asking yourself why. Now, another reason is fear of result, which is why I explained I had to bring a picture for us to understand what the screening procedure is like. Fear of result. What if I go and I test positive? What happens, right? You will get treated, which is why I talked about the treatment as well. The treatment also doesn't take time. In about 20 minutes as most in a doctor's office, you get treated. It's not like you stay in the hospital the same day after you finish your treatment, you go back home. A lot of women go back to their normal activities, their normal day-to-day activities after having these treatments done. It's not a big deal. There are no side effects, just normal procedures, no complications. Sorry, that was what I was trying to say. Just normal procedures. You may feel pains, you may feel crampings, from the ice that is placed on the cervix, but it doesn't last long. It's better to go screened, go and get screened. If there's anything there, you treat it. So you go back to living your life. At least then you know that you are safe, right? So this is a joint presentation. Sorry, you may see different images because it's a presentation for breast and cervical cancer. So I'll just select the images to show. Now, cervical screening, how do you prevent it? Cervical screening, you go and you check for abnormal changes on the cervix. These abnormal changes caused by the HPV, human papilloma virus. Cryotherapy treatment, I talked about it earlier. It's the same procedure. They see your cervix and have it the ice pressed on your cervix. They use an instrument called a cryotherapy gun. This is not what it looks like. This is a different image for screening. It uses a cryotherapy gun to treat all of those cells. So it destroys it. It comes out as discharge, and they check you again in 6 months to be sure that it has cleared. If it hasn't cleared, then they might decide, depending on your case, you might need to repeat the treatment, or you might go for a higher kind of treatment that would, take much of the cells if the infection has spread. There are other treatment procedures. There's one called LEAP that they use something like a wire, an electric wire, to cut a chunk of the cervix out. So there's always an option when you go and get screened early. Women do not have to wait until you are bleeding, until it has gotten to the stage where nothing can be done, and then women have to suffer, right? So prevention is key. Prevention is not only better than cure, it is also cheaper than cure. Now, you also have vaccinations available. So the vaccine up here is called Cervarix. It protects against the 2 strains of the HPV virus known to cause cervical cancer, right? It's taken over a 6-month schedule. So for example, if you're having the first dose in January, you take the second dose in February, and you take the last dose in June, or 5 months, 5 or 6 months from when you started the vaccine. And in 6 months, your vaccine is completed. Now, this vaccine is also available for girls from the age of 9, right? So girls can take it from that age. So they are protected from the virus before they become sexually active, right? So in other countries, you have this as part of the immunization schedule. So once they get to a particular age, they go and they take the vaccines, but it is not available in the national immunization schedule right now. So the last cancer control plan they had, because they do a cancer control plan every 10 years, it was said that it will be included. But before then, you can always visit any hospital, clinic close to you to ask for the vaccines if you have daughters that are 9 years and above. Now, if a lady is sexually active, you would need to get screened first before you take the vaccine, because the vaccine doesn't treat an already existing infection. You would have to treat first if you have the infection. It doesn't protect you from strains that are there already. So you would treat first and then take the vaccine to protect yourself. For women, adults who are not sexually active as well, you can go ahead and have the vaccine. If you're sexually active, you get screened, negative, you can have the vaccines. So these vaccines are available for women until they clock age 46. After then, it's still available, but it is not as effective. So they will always tell you ahead, have the vaccines. Fine, it will protect you to an extent. All right. So I've come to the end basically, but before we talk about before I go to the stage where I start asking questions, when I go for outreaches or go to give presentations, I like to put prevention and treatment side by side. So when people are told to go and get screened, they understand why they need to get screened and how it benefits them. Prevention is not only better, but it is cheaper, right? Chemotherapy in places, certain hospitals, you can get the chemotherapy for about 300,000 naira. In some other places, it is even more expensive. Some people will have to take it every 3 weeks. I told you this was a mixed presentation. So I talked about mastectomy, which cost about 500,000. Now, mastectomy is a procedure to cut off the breast. It is not free. You still have to pay for it. People have to go for radiotherapy treatments that goes for as high as 600,000 naira, depending on your case and the stage, it has gotten to. Some people would have to do this every day for a period, or depending on whichever, your doctor says is best. And 3, I put here, right here, is the number of functional radiotherapy centers, we have in Nigeria the last time I checked. So having the money is not even enough. You now have to pray and hope that you find somewhere where you can get this treatment. So when you go to some of these hospitals, I think Lutz has a functional center, Abuja Hospital as well. But when you go there, you see a long queue of people waiting to have these treatments, done. So the services are not even available at the time. Now, on an average, a woman can spend up to 30 million naira treating diseases that can be prevented. It doesn't make any sense. And then women are dying year after year in thousands. Like I like to say, it's needless and it's a waste of, of human lives. So we should begin to take these things very important. If you're a man listening to this lecture today, you ask your wife, have you been screened? For breast cancer, on the other hand, you have to get screened. If you're above 40, you need a mammogram at least. You need a mammogram once a year. Below 40, a breast scan once a year, in addition to a monthly self-breast examinations. These things are very quick. They don't take time. So I'll encourage you, to go and get these screenings. A prostate screening as well, just like our professor has said, it's very important. Prevention is not only better than cure, it's cheaper than cure. I really want that to stick with you. And early detection is key. So basically, I've come to the end of the lecture, and I'd like to take questions if there are any. Thank you.
Thank you. Okay, thank you very much.
Thank you, Doctor.
Thank you so much. That was very information-packed.
Thank you.
Very, very good. And very good for laymen like me, we don't know anything about medicals. I was able to understand everything you were saying. I was able to also understand that cervical cancer is actually not carried by women, but given women are affected by cervical cancer, but they are infected by men, and it's something that is sexually transmitted.
Yes, and men do not have any tests to detect it, because of course they do not have a cervix. There are no vaccines available for them in Nigeria right now. So the responsibility lies on the woman to continue to get screened and get vaccinated.
Okay, so you said the symptoms are painful, pains during sexual intercourse, lower abdominal pains, and then you're advising that we should go for screening, especially if you are sexually active.
Yes.
We should also, and once you have been exposed to sex, you just begin to go for screening. I wanted to ask, how regular should these screenings be?
Okay, now if you have never been screened, you should go first and get a screening. Now, depending on your results, you'd be given your next appointment. For some women, it's once in 2 years. If you screen, you test positive, you treat, that would be every year, depending. So the doctor would be the one to give you, your next appointment. And women screen every year until they clock 65. So once a woman clocks 65, she stops screening.
May I know why?
Yeah, because at that stage, if you've been screening before and you're not there's no infection there, then they really don't want to continue stressing you and asking you to come. At 65 and you've been tested positive previously, how many more years? So at that point, they just tell women to stop screening.
Oh, wow. That's interesting. I can't wait to be 65. All right, so fear of results. Okay, that was interesting. You talked about fear of results, and you told us that these treatments, they don't take time, screening don't take time, and that there are no complications as a result of either. I want to know at this point, how much does it cost to go on a typical test? What should I be looking at?
Yes, that would vary. In Abuja now, there's a pap smear would be around 8,000-9,000. I think the last time I checked, that's just a range. And then you have a liquid-based cytology that's about 12,000 to 15,000. The last time I checked as well. So a pap smear is the same way they view your cervix. A small brush is used to collect cells from the cervix, and they take it to the lab for investigation. The same with a liquid-based cytology, as well. So that's the range. However, for visual inspection, it can be cheaper because, like I said, WHO recommends it for low resource settings. Many times we go on outreaches, we do the visual inspection. I'm not sure how much that costs. In Lagos, I think a place I found some years ago was about 6,000, I'm not sure, but many times you would get it for free with NGOs. We screen for free, and that is what we do as the first line of screening, right? First point of call. Now, if a woman screens and is positive, depending on her results, the doctor would now recommend a much more comprehensive test. So we don't want the price to be the reason why people will say, oh, I can't get screened. So go there first, do a visual inspection, let them know if there's something on the cervix, and then you can now go for a more another procedure or an investigation that would let you know what stage of infection the HPV is, right? So this visual inspection can work as the first stage. However, if you can afford having a pap smear or liquid-based cytology, why not walk into a diagnostic center, and have it done? But for those, you'd have to wait for about 2 weeks before your result comes. But the visual inspection, you'd have your results the same day, and then you can take the next whatever the doctor prescribes, right? So you can do it immediately, which is that the reason why the visual inspection, many people even prefer the visual inspection, is that you can start acting on it immediately. So when you go and do pap smears, and all of those other tests, some people don't even go back for the results. Many of the centers, they don't follow up. But if you go and you have those screenings on, please don't let that, deter you. Follow up for your results, wait to get it, and so that you can take the next step available. I had a pap smear sometime, I think last year, just before I took in for my child, and they didn't even tell me the results until after 6 months. I had to call them and say, do you have a no news, good news policies? Because some of the centers, they do, if there's nothing there, they just don't bother to call you. And then I had to talk to them about my results and everything. So you also have to follow up. You go and you have these screenings done, please follow up, so you can start taking the steps you need to prevent this disease in your lifetime.
Wow. Thank you so much. And the main thing here is prevention is better than cure. And that's and a lot cheaper, because the prices are scary, know. And then you told, there's something you said that vaccines should be taken by girl child from the age of 9.
Yeah.
How much does the vaccine cost, and how do we get these vaccines?
Well, vaccines, it depends on where you get it, right? For some places in Abuja, I think the highest I've seen is about 30 something thousand per dose. And then you have to take 3 doses. There are also places where you get it for 25,000. It depends. For us, we have a partnership with a particular pharmaceutical company, and we give the vaccines at about 13,500 naira per dose to adults. For girl children, it's about 12,000. So we give these vaccines together. So it depends on where you get it. And of course, some people will say it's expensive, but you have to look at other factors causing this rise in price. It's not available, in the schedule, but very soon, hopefully, it will be available in national immunization schedule, and then maybe we can have a reasonable amount and price. But it's still not too much, right? It's your health, and you should do
Yeah,
these
it's not
things to
compared
help
to
to
what
protect
it
your
could
health.
cost their lives. Yes,
Yes, of course.
yes.
Yes.
And take home here is that if you are sexually active, you should go for tests and a screening, and then you should also, after doing that, ensure that you take your vaccine if you're
Yes,
sexually
ma'am.
active. It's very
Yes, ma'am.
advisable. And also, if you can afford it and you have your girl child from the age 9, you should give her a vaccine.
Yes, and something we do in our center as well is to give people payment options, so you can even pay through the 6 months period, whatever you can afford. You keep it for people who are really interested and then want to get these vaccines. We can work out a plan
Okay,
for
so
them.
you might need to share your details with us on the chat room, so that we can get in touch with you. I know that you would come back again, because a lot of people didn't get the information. I'm sure we'll have more people wanting to know some of these things. I hope you'll be available for us.
Yes, of course. I'll be very much available, ma.
Thank you very much.
Yes,
at this point, I want to open the floor for questions. But before I do so, there is somebody I want to speak for just 5 minutes. His name is Frank Agodi from the US. He has 1 or 2 things to say. Could you just unmute his mic and say something, please? Thank you.
Yeah, thank you very much. Can you guys hear me?
Yes, we can.
Yeah, Architect Ono, thank you very much for putting this together. I don't even know that architects can do this. This is something that you did very well. And I am so much happy when I saw Prof made a presentation on prostate cancer, and she hit it on the nail. And also the last speaker, this is one of the areas that people has not really paid attention to. Yes, all those in prostate cancer, all those attributes that she mentioned, those are applicable and affect men. And also the some of the things that people can eat by diet, she mentioned, was also advisable, including a reducing of animal fat and avoiding fatty acid, trans fatty acid, and all those things that she mentioned. The one that is a little bit harder for us, people taking vitamin B and zinc, all those things are good, and vitamin C. The one that is kind of hard for us is red meat. You know that anything what we do in Africa, you have to, cow, goat meat and everything. But because of how hard we Black people digest red meat, is something that if we can avoid it, is very good. The thing that, and also the about the pelvic cancer, that is something that everything that she said was correct. But the only thing that I was scratching my head here is one of the health maintenance is, when you reach, some doctors here now has find that because of, everything about us, Black, attributable to some of these communicable diseases, that they reduce the age to 45 to 40 for men, and even for women for mammogram. So how easy is it for people to go to, when they say this screening, here is a health maintenance is something that they added to your health annual physical. Is it easier for people to go, because we'll be hearing about prayer and hope. I had prayer and hope. So in a situation like that, are we doing prayer and hope? Yeah. So we should find a way to increase and have advocacy so that government should help for people to go and screen. Because if you don't screen, and also to increase that honor, please, we should try to increase this message and see how you guys can lobby the government so that instead of prayer and hope, women and men can also actually go and screen. Now, another thing I did when I was doing my research here, I mean, one issue we have with Black people is that we believe that this power, sexuality, no man want to go and do prostate when they find that they have a prostate cancer, the radiation, because I didn't hear about the after effect of radiation. Some people don't want to go because they ask about men get impotent after doing it, that they say they don't want to do it. So women should help the men to go for checkup and be with them and support them so that regardless of what happened during the radiation, because there's going to be after effect, I'm there with you. Men feel so complex. If they feel that they're going to have an issue, they will not perform, then most of them don't want to go. You're going to ask them, do you want to be alive and watch these kids grow, or you just want to be after your manhood? That is one of the messages that I use here when I speak to people, that women should help men and give them encouragement that no matter what happened, I'm here. So this presentation is good. Continue doing this, and you people should lobby the government to participate so that they make provision for the screening. Thank you very much for the audience.
Thank you so much, Frank. We're grateful for that contribution. Like you said, women should help men, and men should also help women to ensure that they go for tests. I know that my husband goes for checkups every year. I'm the one that puts it off. So after this, I think I would have to repent. I would have to repent and start going for checkups. One of the things I would like to emphasize, because there are questions in the chat rooms, it's about at what age do you stop having vaccines? And she said at the age of 45. And you also stop checking up at the age of 65. I want to check and see if we have more questions. Okay, she gave us more information. She said the vaccine schedule, first dose, second dose, 1 month after, and last dose 5 to 6 months after. And I remember her saying that when you do these tests, okay, that was for tests. She said, when you do the test, make sure you follow up and get your results. Somebody is emphasizing what I already said, that men and women should be there for each other. I remember Professor Ifoma telling us that the women should watch out for the symptoms for the men. When you don't see your husband too often in the bed, you will know that something is wrong. Advise him to, to go for checkup. I think at this point, in the absence of questions, we'll be rounding up this segment. But before we round up this segment, can I just give 1 minute and see if there are any questions? If you have any questions, put up your digital hands so that you can speak. You can ask your questions. Do you have any questions? Does anybody have any questions? It's been a wonderful time. I told you we have the best speakers on this topic, and I'm sure we all learned something, and we should pass it on actually. And some of us, okay, the hands have started coming. Okay, and some of us who have the heart of gold, this is a good place to start up an NGO that would notify people or inform people about cancer, cervical, prostate, And remember what was said, there are three major ones: cervical, prostate, and breast cancer. So if you have the heart of gold and you're ready to work for humanity, these are places that you should try and have interest. I see Mina. Could you unmute your mic and say what you want to say?
Okay, so good evening. I had fun. Thank you so much. Knowledge transferred, and the next thing is to implement. Okay, so I think my question has already been posted. Maybe I could repeat it. It's a very subtle question. For example, this issue about cold water. You mentioned we shouldn't bother taking much of cold water. Okay, here where it's so hot for us, I mean, half the time we're taking ice juice, cold water, iced water. In fact, every juice we do, we put ice inside. I take ice even raw when it's so hot. And in fact, I just keep taking cold water often. So my own question is, so what specifically can we say are things that we need to avoid when it has to do with cold water? Because it came out strong during the presentation. Thank you.
I think that question is for Prof. Could you take that question, please?
Okay, after food, one of the things that you shouldn't really do is take water with food. So, because when you take water with food, think about it. It's the grinding, the grinding that takes place in the stomach itself, where the digestion also occurs. Most of the digestion occurs, becomes mad, because if you look at a blender, for instance, and you put a little bit of onions and you put a lot of water, you find that at the end of your effort to grind it, still little bits and pieces are there. But the less water you have there, the more it grinds better, which is why you find that people usually will eat food with wine, because that's a small quantity of fluid. But when we drink water, we drink quite a lot of water. So it doesn't make for good digestion. And a lot of people who follow through with this advice find that where they were having a lot of issues with gas and rumbling in their stomach, they now started having quiet stomachs. Now, the thing with cold is that you can imagine where you have eaten food that has been prepared with some oil, and then you pour in some cold water, and what you now have is that you have a congealed, more or less congeal the oil, even more or less hamper the digestive process. But with warm water, which you take, remember I said, take warm water like 30 minutes before, some people say 1 hour, and then 1 hour later. Just try it. Some people find it difficult to obey, but when they start doing that, they find that their digestion is much, much better for them. Yeah.
Thank you so much, Prof. There's another question I think is for you.
And it also helps to detox. That's warm water, helps to detox. Okay,
so I think she has her answer. I'll quickly take another question from Adekoyega. He says, thank you for excellent presentations. Is it correct to say or conclude that every incontinence is conclusive evidenced cancer?
No. Because if you remember when we talked about all the symptoms, we said they are not, for instance, it doesn't give you a diagnosis. Even when you do the screening, you are not going to say it is prostate cancer till it's just suspicion of, and then till you do a histological examination. That is the confirmatory test. You have all those incriminating evidences that really adds up, sums up, and then you move on to that. So having incontinence or having frequency does not definitely doesn't indicate cancer, but it indicates that something is going wrong with the prostate, because the prostate is hampering and reducing the caliber of the urethra, and giving you that full bladder effect even after you've emptied, and causing you to feel as if there's a golf ball there, And of course, the dribbling, because there's a blockage and it's not a free flow anymore. So this can all happen. I mentioned it with benign prostatic hypertrophy. I also mentioned at that time about the erectile dysfunction. And I said that even after treatment, this is also a problem. So I thank Agodi, Dr. Agodi, for bringing and emphasizing that issue and the support that is necessary. He also mentioned the issue of, payment. The problem that inundates late detection, especially in cancer, even in the entire African continent, when you go for conferences, they will tell you that if you ask three things that is responsible for the increasing mortality and morbidity statistics for cancer in Africa, they are: number one, late detection; number two, late detection; number three, late detection. So they inundate it because the person is afraid to go and access care because he's thinking of his pocket. So out-of-pocket treatment is just something that we really need to fight in this country. And the answer is definitely universal health coverage, having a functional insurance scheme and ensuring that the citizens know that this insurance scheme are actually in place. There are some of them that are in place and are affordable, but nobody is taking them up. And a lot of them are also pretty inefficient. So this is where we bet. Having the government tell you, oh, they are going to pay for screening, that doesn't happen. It's mostly NGOs, looking for people to help. And Architect Ono, you advise people to start NGOs, even if you don't want to start an NGO because it's quite a big deal. You can find NGOs that are really working and support them, and give them money to help to screen 500 people, screen 200 people, screen 300 people. And then the visual inspection with acetic acid, there are places where you can get it as cheap as 500 naira, 1,000 naira.
Awesome. Awesome, really awesome. Thank you so much for that, Prof. Yes, that is true. It's better sometimes and easier to collaborate or join existing NGOs or people who are already on that path. Thank you for reminding me on that. There is a question here. It's from Mary Angela Momo. She says, does sitting posture accelerate prostate cancer? Does sitting posture accelerate it?
A sitting posture does not accelerate it. Unless the question is it part of sitting disease? Because sitting, it means the person is sitting more there than they are active. So sedentary lifestyle is one of the major reasons for non-communicable diseases generally, major reason, So okay. With the computer, working on your laptop, and all, you find that a lot of people are sitting for hours. I mean, I'm a culprit. The advice is that you should set up an alarm, and every 30 minutes to 1 hour, you get up and, take about 100 steps and then come back and sit down. But a lot of us don't do it.
Yeah. Just to add to what she said, sitting at this area, sitting too long, might not give you a big belly. You can also raise your red flag so that, some people say that they might, somehow because they affect every other health issue, not only prostate cancer or prostate.
Okay. Thank you very much. This has been awesome. Prof, I hope we could always call upon you for this service. I know that a lot of people, would want to hear more. And I know that your presentation was cut short. So I would appreciate it if, just hang on, please. We need to take questions from George Andreas. Could you unmute and quickly just say something in 30 seconds?
Yeah, first I want to thank the professor for her presentation and the other lady. My name is George. For the cervical cancer presentation presenter, we would like to make this kind of treatment get to the grassroots, because the major problem that stands on the way between these people are part of awareness and the willingness to do it is also finance. So we can be able to, as NGOs, work with you people who have this direct partnership with the pharmaceutical companies, so we can bring down the prices of these services very, very minimal. And then we raise fund. When we raise fund, we can be able to raise fund for maybe 500 people, like the professor said, or 1,000 people, and then work in collaboration with you people to make sure that people from low-income families who cannot afford this can get screened. That's the work of that's one of the jobs that NGOs are supposed to be doing with the foundation. Secondly, Bob, the aspect of prostate cancer you just said is very clear. It's very clear. But I also want to say that sometimes we also don't mistake voiding, frequency in voiding, as begin to get anxiety that we have prostate cancer. In the context of, sometimes you find out that, well, like me, if you have the feeling to void and you are not within the place where you can void, you see the ability to hold on that void for a long time is there. But once you get to your house and you set your eyes on your toilet, or you even open a running water, for instance, as I'm a nurse by profession. So what's one of the ways we use to improve voiding in terms of urinary problem, or when somebody has difficulty to pass urine, is to open the running tap. Just get the tap open. Once that tap is running, you find out that the person will have the willingness and the urge to void. So sometimes you may be able to hold this thing when you are out, but once you get to your house and see the toilet, this thing comes with the kind of force that you never even believe. If you are not even fast about it, you may even wet your body. So sometimes we should know that some of these things too are psychological. They are not just that they have a pathophysiological
Okay.
Yes, thank you.
All right, I'm running out of time, George. Thank you very much for that contribution. Can I take on May Ikoku, please? Dame May.
Yeah, thank you for fantastic lectures. I have two questions. One for Dr. Nyong. I had asked, what are the intervals for the vaccines that are to be taken? And then the question for Professor Okoye, it's a man that sent me the question, asked me to ask on his behalf. He says for prostate cancer, there are a lot of medications, medicines and pills on internet, you know. Are they okay? From the social media, you know, they have all these medications. Are they real? Can they follow them without doctors' prescription? Thank you.
Can I quickly answer that? I'm sure that you saw my slides were riddled with see your doctor, see your doctor, see your doctor.
Okay.
Because we know that there are a lot of, maybe I shouldn't use charlatans, but there are a lot of people peddling all sorts of things, you know, with the full intention of just making money from the lay public. So the important thing is your doctor is your friend. That should be your friend. And at the worst, if you don't have access to a doctor, see a healthcare provider who would be able to direct you appropriately. But please, 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 do not go to the internet and copy out things and begin to use, because you never really know. We've had people have kidney shutdowns from using some of those medications, especially all those local, not that we are looking down on our, natural products, but they need to go through a process called clinical trials. And it's quite a huge process. And you can't cut corners on these issues. For anything for human consumption needs to go through efficacy and safety issues before you take it. So please do not. Some of them are just even riddled with bacteria. They're just riddled with bacteria because you don't know the circumstances that they produce it.
Wow, that's interesting and scary.
Question. Sorry.
I'm afraid we have to end. I hope that who wants to ask? Okay, please do.
Yeah, the vaccine schedule.
Okay, yes.
So it's taking over a period of 6 months. So if you start this month, for example, the next dose will be 1 month after, and the last dose, which is the third dose, will be 5 to 6 months from when you started the first dose. So in about 6 months, you should complete the vaccine schedule. However, if you start and stop, depending on the time interval, you may need to start again. So it's always advised that people keep to the appointment schedule and then complete the vaccine. And then for the person who talked earlier about our NGO going to the grassroots, we do a lot of that. You can see on my screen here, this was a village we visited in about 2 weeks ago, Nako village, somewhere in Buari area council, a bit far from the city. Now, these places, they do not even have primary healthcare centers. We go there, we screen and we treat, because I talked about the follow-up and all of that. Many times you lose patients, in that time. So we go there, we enlighten them, we screen, we treat, and with just 2,000 naira, we can screen a woman. So most times we get donations, from corporations, from individuals. 2,000 naira can screen a woman, breast, cervix, and we also do the treatments as well. So these are things that we do, and we also encourage people who would like to support us as well. Thank you.
Thank you. I'm sure you can collaborate with as many organizations as possible. Is that what you're saying?
Yes, organizations, individuals, doctors, anyone who would want to. Yes, we're open to collaborations and partnerships.
Thank you so very, very much. I want to say something that just came in from Dr. Frank Agodi. He says, in conclusion, prolonged sitting leisure time are associated with incidence of some specific types of cancer in men, including colorectal, prostate, and lung cancers. Specifically, prolonged sitting is associated with increased risk of prostate cancer, while low leisure time, PA, is associated with increased risk of colorectal and lung cancer. Moderate leisure time is associated with reduced risk of prostate cancer. Our results reaffirm PA as a key component. I might need to ask, what is PA? As a key component of population-wide cancer prevention. And we need to consider recommendations about decreasing time spending sitting. So we should decrease the time, just like Prof said, the time we spend sitting down. At this point, I'm afraid we just need to call it a close. But before I do that, I want to ask if the president of the Coalition of Societies for the Rights of Older Persons is on. I might need to also tell you that my name is Architect Victoria Onu. I am the programs coordinator for COSROPIN. Senator, are you online? Okay, all right. So at this point, we want to call on our very own Secretary General of the Coalition of Societies for the Rights of Older Persons. She is also the MD, the chairperson for her for her organization, Save Our Heritage. Okay, Save Our Heritage. I'm so sorry, Atime. I'm calling her right now to do a vote of thanks on behalf of the coalition for this awesome, wonderful, wonderful time out on our health series. Then May Ikoku, please.
Yes, on behalf of Coalition of Societies for the Rights of Older Persons in Nigeria, COSROPIN, I wish to thank all those who participated. From beginning, we had about 56 people, maybe more. But I'm glad that even as we are ending, we still have 45 people. I give special thanks to the presenters, Professor Ifeoma Okoye and Dr. Nyong, and also for the moderator, Victoria Honor Architect, and for the president of the coalition, who also conceived this idea. And we also thank the doctor that called in from the US. Thank you very much, everybody, those who participated from outside Nigeria, Dr. Andreas, and the rest of you. We thank you very much. Soft copies of these presentations to everyone. Thank you very much for listening, and I hope you will join us in our future presentations. Thank you. Hello.
Thank you for having us.
You're welcome.
Okay, thank you so much. Please try to unmute. Okay, you could get in touch with, check the chat room. You could get in touch with Mrs. Stephanie Young. Her contact details are in the chat room. At this point, I want to say a very big thank you to everyone that has made it on this platform today. God bless you so much. And till we come again your way with things you ought to know concerning your health in our health series. God bless you. Thank you so much.
Thank you, Ma.
Thank you, thank you, thank you.
Thank you.
Thank you. I can see Margaret.
Thank you.
Awesome time. It's been awesome. Thank you so much.
Mrs. Ono, I greet you.
Greetings to you from Canada. We have people from all across the country. We have, I know somebody from New York is here. Somebody from London is here. Somebody from Italy is here. Thank you so much for making it here. I can see my people, they're all here. Thank you.
Victoria, how are you?
Bye.
Oh, this is me seeing Nita for my first time. That's wonderful. Nita,
Thank you for putting it together.
Oh my God! I seeing Nita for my first time. Nita said that I cannot hunt a fly. It's a lie. I can bite and